Hello, I'm Rebecca Cazzato, RNPC Grant Team faculty member.
Hi, my name is Heather Hunt. I'm the RNPC coordinator and liaison.
Hi, I'm Rachel Whitney. I'm the RNPC research assistant.
Hi, my name is Dana Hill and I'm the RNPC advisor.
What sparked my interest in the RNPC program was the fact that I really didn't know what I wanted to do in nursing at all. I wanted to immerse myself in all of the possible opportunities that I could in order to figure out what I liked and what I didn't like, and hopefully figure out a path that I could pursue as a career in the future.
I hear a lot about what you can do when you get your nursing license. You can work on the floor, you can be a manager, you can go all around the hospital, you can float around, but not a lot of people talk about ambulatory care. And I remember Heather Hunt came into our classroom and talked to us about it. And it just sparked my interest because it's something different and it's not like a usual path that many people take.
But it also lets you see different aspects of healthcare and forces you to kind of look at different processes that you might not normally see within a traditional like med-surg scope at your local hospital.
We see the acute care side in the hospital as well as the ambulatory care side, which really nursing, there's so many opportunities beyond just working in the hospital as a bedside nurse.
I've been able to see the outpatient and ambulatory side of nursing care as opposed to just the inpatient side during our clinicals at Davenport. I feel like the RNPC initiative really gives me the chance to experience the different roles of nursing, such as primary care, specialty care, and the different patient population.
I was looking for something that would add to my experience here at Davenport and overall improve my nursing skills. I also wasn't very familiar with the veteran population at the time, so I wanted to learn more about their health concerns and how better to serve them.
I think because I am a veteran, I was just naturally drawn to apply just because I'm interested in working with veterans.
What originally prompted me to join the RNPC initiative was my brother, my uncle, and my grandfather are all veterans, and they inspired me to give back to that vulnerable population.
You're taking care of specifically the veteran population within the Wyoming VA, which is where we went, and it's in the ambulatory care setting, so it's more like a doctor's office that also has different specialty offices within it.
Really was eager to work within the Wyoming VA healthcare setting because this is such a unique facility. It is large, it is an outpatient clinic, but it has so many different specialties housed within one facility, and I thought, what a great opportunity to work within multiple specialties to try to figure out what field I might go in.
And it was really great to be in the RNPC program and experience the ambulatory care setting in the VA. Met a lot of great nurses in the VA. And beyond just the VA, the RNPC program also sends you to a OB clinic for OB clinical as well as a PEDS clinic for the PEDS clinical. Those were also great experiences as well that you wouldn't have if you were not in the RNPC program.
Because I think really right now we're all like, hey, I want to go to PEDS, I want to go here, I want to go there, but we're not really 100% sure where we want to go. And any additional experience kind of opens up those thought processes, those light bulbs go off. You go, that's kind of interesting. I might be interested in that.
I was in the wound clinic, the pain clinic, rehab, GI. I worked with the PAC team nurses, with the PAC team pharmacists. There was just so much more that I was exposed to than other students.
Honestly, allowing me to see so many different things in nursing that you don't normally get to see in clinicals. So with the VA, there are so many different clinics in specialty, and there's GI and podiatry and pain, and primary care and all of the different settings that we get to be put in. And it's exciting to see the different aspects of each of those specialty clinics that you normally wouldn't get to see in a normal clinical.
Seeing how a provider and a nurse and a case manager and mental health and the labs and everybody communicates.
The VA is totally different because the patient that walks in the door could be seen for like a GI problem, an ortho-related problem, and it's as a nurse, as their nurse, you triage them according to what they need in that moment. So you're not specialized to one thing. So hearing the nurses that I've shadowed try and troubleshoot problems that they might not 100% hear about all the time makes them have to learn consistently, like continuously every single day. And knowing that that's a big aspect of nursing has really like put it in perspective for me.
It's a different view on different areas of healthcare. And I think that getting different viewpoints prior to graduating and taking your NCLEX and all that and getting out into the quote unquote real world of nursing kind of gives you more ideas of other places that you could go.
I thought it would be a good opportunity to serve the veteran community, gain experience in the ambulatory care setting, so something different than our normal clinical rotation. Plus, they offered a summer externship so you can gain extra experience within the nursing community.
We were offered a chance to work for the VA over the summer and get paid for it, which really piqued my interest. But ultimately, it was that chance to get my foot into the door and familiarize myself with leadership there.
And as someone without any healthcare background prior to getting into nursing school, any additional hours I could get working with real live human beings, patients, clients, things of that nature, was a huge thumbs up pro to me.
And then also the externship, I feel like is a great way to learn patient care in a different way other than the clinicals, because in your clinicals you're just on the floor of whatever unit you're put on, and it's something that kind of sets you apart and will benefit you long term, even after you get your degree, I feel.
It allowed me to get a lot of patient care experience, practice my skills, and it looks great on a resume.
The 12-week externship at the Wyoming VA was also a great experience that I'm very thankful that I had in my nursing education. I feel like it really did enhance my nursing education. If I hadn't done the RNPC program, I probably likely would have learned a lot less about nursing.
It was interesting to be a part of this initiative during the time of the COVID pandemic to see how they handled it, the opportunities to kind of view the telehealth and how they were utilizing that during the pandemic.
If you're teetering on the idea of whether or not you want to be a part of this initiative, I think you owe it to yourself.
The RNPC experience has enhanced my nursing education.
Yeah, I really recommend the RNPC program.
It's just a great opportunity to figure out what it is that you're interested in going into.
This experience has been very beneficial to my education.
It has opened up doors to so many different types of nursing.
The support I had from the RNPC faculty was also very helpful. They were always there if we had any concerns or if we need someone to talk to.
It certainly has been a great opportunity for me.
I would highly recommend someone applying to this program.